dear colleagues, dear friends. Welcome to the final day of our global e-conference, turning the COVID-19 crisis into an opportunity. What's next for social protection? So we had some amazing days, but before I tell you a little bit about what's happened in the last 3 days, I want to make 2 short announcements. First of all, please be reminded that we have translation for you. So we are going to provide Spanish and French translation. So if you look on your screen, in the bottom, there should be something called interpretation. And if you prefer rather French or Spanish translation or vice versa, then you know where to find it. Secondly, please keep an eye on the chat box, because we are going to send interesting links and information via this channel. So let's start our final day. The title is Global Lens, the Future of Social Protection in Times of COVID-19 and Beyond. And I think we had some amazing days and a lot of exchanges, and many of you took the opportunity to participate in many of our sessions. So the first day we actually had a session over 3 time zones with a regional focus. We moved from Asia and the Pacific to Sub-Saharan Africa and the MENA region. And finally, we ended up in Latin America and the Caribbean. We heard a lot of country examples and stories from the field about various social protection responses to COVID-19. Some of them presented by senior experts from governments, including several ministers. And each time the regional session was followed by a peer-to-peer dialogue among participants. So on Tuesday, actually, we provided an open space with a thematic lens to focus on specific questions related to social protection responses to COVID-19 and beyond. This was actually the core of our so-called learning journey. So we had 3 different session formats: the clinics, the roundtables, and a virtual expo, the so-called virtual booth. And also this was offered through 2 different time zones, Asia Pacific and Latin America and the Caribbean. I witnessed myself 3 clinics and I really enjoyed it, and I noticed that many of you could have gone on for hours. On Wednesday, we had a couple of side sessions, in total 9 of them, hosted by different organizations, and many of them had more than 130 participants at certain times. So now we reached the final day. So you can see on the screen right now the work of Sonja Niederhumer, our graphic recorder, who captured the last days for us. And she will do her job again and captures our conversation on the final day. So we will try to summarize today the discussions, the lessons learned, the conclusions of the previous days, responding to the guiding questions that framed our event. So we are going actually to conclude with 2 panels. The first panel will discuss on how to ensure the social protection programs and systems are better prepared and ready to respond to systematic crises and shocks. And secondly, we're going to have an expert panel after the coffee break on how to sustain the social protection responses that have emerged during the crisis in the long term to ensure equitable access to comprehensive risk coverage for entire populations. And then we will conclude with some closing remarks. And at the very end, don't go away, we're going to have a virtual cocktail, and one of the most famous Latin DJs in the world, a Grammy-nominated producer, will actually help us to end this conference actually in style. But now back to social protection. And before I forget it, in the coffee break, we are going to have our magician again, Stuart Lightbody, and he asked me to remind you, if you have a pack of cards, please bring it. So then you will enjoy it even more. But this is our program during the coffee break. So if you have been part of the regional conference on day 1, then you will remember how good he is. So now let's start with a retrospective for day 1, given by our excellent moderators who were actually moderating the regional sessions on that day. And I will call upon one by one Each of them will have 2 to 3 minutes to share their insights. And let's start with the Asia and the Pacific. And I would like Wendy Walker, the Chief of the Social Development Thematic Group of the Asian Development Bank, to summarize some of the insights and learnings from the regional discussion in Asia. Over to you, Wendy.
Okay, thank you, Jost, and thank you, everybody. The regional session was organized, I guess, like the other ones, with an overview first by the IPCIG colleagues on what has been happening in the region in terms of response, and then 3 country profiles from Pakistan, Indonesia, and Cambodia. So first, Dr. Sanya Nishtar in Pakistan spoke about the EHASH emergency cash program that was set up in record time to provide one-off emergency cash payments to over 16.9 million families, covering approximately 50% of the country's population. The EHASH program innovated to rapidly expand by developing a hybrid targeting approach using the existing social registry and expanding the identification through demand-side SMSs to request for assistance and data analytics to select the beneficiaries. Payments were made through a biometric payment system. The main takeaway here is that the use of digital technology allowed government to venture in new ways of doing things at scale and something to build on towards the future, and that the ability to deliver at scale with efficiency and coordination across government is a big achievement. Pamaliki in Indonesia from Bappenas elaborated on the wide range of social protection programs that were available before the COVID crisis and were further expanded during the crisis to cover almost half of the population and allowing to contain the rise in poverty. The main components included the national health insurance, subsidized for the poor and vulnerable, the CCT payments that were increased during the crisis, and the job security measures, including unemployment benefits, reskilling, and incentives for SMEs. The main lessons were the need to develop a well-functioning social registry, coordination among the different partners at national and local level, and the need to combine social assistance with economic empowerment. And going forward, the need to develop more adaptive social protection systems. And finally, from Cambodia, they explained, His Excellency Teng Pangatan explained that the social protection is still at a very nascent stage in the country, but nonetheless, there was an existing social registry before COVID called ID Poor that was rolled out further during the COVID crisis using an on-demand ID system at the commune level. And towards the future, this expanded social registry can be used to further build out the system within Cambodia, and the use of technology was key in successfully expanding it. So among the next steps and challenges noted were developing social protection responses to support recovery and extended livelihood disruptions, using technology, updating social registries, and developing capacity for interoperability among different line ministry programs, building capacity at national and local government stakeholders to be able to design and implement sustainable systems that are shock responsive, and strengthening coordination was mentioned by everybody at and between the national and local levels. And lastly, one of the important lessons going forward is the need for sustainable financing that will require the strengthening of domestic resource mobilization. Thank you.
Thank you very much, Wendy Walker from the ADB. And let's move on to the MENA and Sub-Saharan Africa region. So we have with us Renata Novak, the Social Protection Employment Program Specialist from the United Nations Development Program based in Addis, and Salman Tapa, the Regional Advisor Social Policy for Middle East and North Africa based in Amman from UNICEF. And I'm not sure who's going first, but this was a session, we have both speakers because we are covering both regions. Over to you.
Okay, should I go first?
Go ahead.
Okay, great, thank you. And good morning, good afternoon, good evening, whatever applies to you currently. So let me share some highlights from our panel on Sub-Saharan Africa and MENA regions. And of course, we could concentrate on many constraints that have been mentioned on the capacity gaps, fiscal space constraints, or gaps in coverage of certain populations. But to keep with the spirit of the conference, of using the COVID, turning the COVID-19 into an opportunity, I would like to highlight specific takeaways towards that goal. First, with this conference and with the efforts of socialprotection.org, IPCIG, but also from other actors such as World Bank, UNICEF, UNDP, also ILO, we now have rich body of evidence on different measures that have been applied by countries to extend protection during this difficult time to those who need it. And this body of evidence can be now used by policymakers and constitutes really important inputs for policymakers, researchers, and advocates, and whoever, and civil society, and whoever is interested in pushing this agenda forward. Second, some of the measures that we have seen show real ingenuity and innovations, and we have just heard from Wendy on digitalization and the opportunity going forward. This is also the case in the panel that I was moderating. Swiftly, payments, transfers were delivered at a large scale to a large group of populations that needed it. Also including, in some cases, actually in many cases, people who are outside of the social protection and national registries and databases. And this really provides evidence, again, for policymaking that things can be done, and things can be done quickly if there is a will, if there is a need, even under such difficult constraints as public health and social distancing measures. So for example, we've seen self-registration, verification, WhatsApp platforms, and other means that people could use to register. So this is another very important learning from the panel. Third, and I would like to recall here the presentations of the countries by the representatives of the governments of Congo, Namibia, Jordan, and Morocco. These governments really show commitment to not just to the temporary measures that they have presented and discussed, but also to the systemic change in their own national policies, strategies, and programs to cover those who need, and indeed to cover all of the citizens, such as in the case of the representative of Morocco. Of course, they also pointed out to difficulties. They talked also about the coordination issue, about fragmentation, or about the fact that national policies are not prepared to be not yet inclusive of the shock responsiveness aspect, and this needs to be worked on. So for example, the representative of Jordan has stressed that, or the issue around data privacy. If we follow the digitalization agenda and use it as sort of quick wins for the delivery and any part of the social protection cycle, then we really need to think seriously about data protection, data privacy issues. And that was the concern of Namibia's presentation as well. But all in all, the commitment of the governments really leaves us with the reason for optimism. And finally, all of this together shows real momentum for change on social protection from the part of the government, from the part of international community. This has really never been stronger, and this is our opportunity to, continue working on this and advocating for this agenda. So these are my takeaway, and thank you for the opportunity of being part of the conference.
Thank you very much, Renata. And over to Saman to add on. Saman, I think you have to unmute your mic.
Hi, can you hear me, Joost?
Perfect.
All right. Good morning, good afternoon, good evening, colleagues, wherever you are. So for the MENA panel, we had two presentations. One from Her Excellency, the Minister of Social Development in Jordan, the other one from the Director of Ministry of Finance in Morocco. And both presentations focused very much on, as you know, panelists before me were saying, on the impressive way in which governments have leveraged social protection as perhaps the key plank of social responses to the social impacts of COVID-19. And in a manner where national systems have been able to respond with speed and at scale. In Morocco, reaching 6 million households in a matter of weeks, and in Jordan reaching 500,000 households, and pretty much well beyond the pre-existing coverage through these expanding it through these emergency cash transfers in a very short span of time. And I think, adopting various technologies to make that possible, contactless registration, contactless payment, innovative ways of grievance redressal and so forth. So really inspiring examples, I think, that help showcase the ability of national systems to respond on time and to reach the most vulnerable. And in a context where we have many countries in context of economic crisis, fragility, and conflict, I think this was a very inspiring set of examples to hear from MENA. I think that also highlighted something that goes beyond the short term and the immediate responses, is the fact that there is a very strong political window of opportunity to drive more substantive social protection reforms in the region. I think we are all, fairly well aware of the challenges that exist in terms of social protection systems in MENA, in terms of fragmentation, in terms of lack of coverage, and so forth. But I think this also showcased that, being able to act short term can have longer term consequences, and governments are actually thinking about that. And just to, give a few examples, in Jordan, for example, Her Excellency the Minister spoke about how they're already updating their national social protection strategy with a chapter on shock responsive social protection supported by UNICEF, which showcases that they have actually leveraged very much in the spirit of this event, the crisis, into an opportunity, and to say that shock responsiveness of social protection systems is something that is not an option anymore, it is actually a need. And the same in the case of Morocco, where the director spoke about the speech of the King of Morocco in driving a move towards universal social protection for all in a manner that is also shock responsive. So I think a very inspiring set of examples, and I think I'll conclude by saying that this showcases the bolder visions for social protection coming out from MENA countries, where there is definitely an increased understanding, I would say, after COVID, about the dynamic nature of poverty and vulnerability, the limitations of narrow and fragmented approaches, and the need to ensure social protection for all. Of course, there's an issue of financing and cost, but I think the theme that came out is that social protection is an investment, and there's actually a cost of inaction, of not being able to expand social protection for all, especially when crises strike. And the last point is that as development and humanitarian partners, we have a responsibility as well to support governments to realize this vision in very difficult times. Thank you very much, Joost. Back to you.
Thank you very much, Samantapa. And now we are moving to Latin America and the Caribbean region. And our moderator and rapporteur is Simone Cecchini. He's actually the Senior Social Affairs Officer at the United Nations Economic Commission for Latin America and the Caribbean. Over to you, Simone.
Thanks a lot, Joost. Well, in Latin America and the Caribbean, we are in the midst of a huge sanitary, economic, and social crisis. 5 of the 10 countries in the world that have the highest number of contagions is from Latin America, and 5 of the 10 with the highest death rate because of COVID are in Latin America. However, governments have reacted, especially from the social protection field. They have reacted quite swiftly. And in this session, we started with a very broad and comprehensive presentation by Ana Machado and Nurf Palomo from IPCIG. They gave an overview of what governments are doing, and they are acting not only from the non-contributory field, but also from the contributory field and from the active labor market policies. In terms of coverage, population coverage, overall, it is quite broad in the region. If we take non-contributory social protection, we could say that about half of the population has been covered, but with great heterogeneity between countries. Also in terms of the sufficiency of the allowances, say, of the monetary transfers, there are quite big differences between countries. This expansion in a short term has happened because we do have social protection programs. In some cases, we can talk about systems in place. And thus, we heard also from the 4 countries that presented, we really had a very high level panel. We had Brazil with the senior representatives in charge of the single registry, and also for Bolsa Familia and the non-contributory transfers. We had the Vice Minister for Evaluation from the Ministry of Social Development and the Family of Chile. We have the Director of the National Planning Department of Colombia, and also we had the Minister of Social Affairs from Guatemala. And obviously that expansion was based on things that existed, right? So information systems and registries, they have been used heavily, but also with innovations there, allowing people, for instance, to register in a more flexible and quick manner. The payment systems were in place, but also there were innovations, saying using cell phones for payments. So a lot of innovation and also a vision that there are not just a series of programs, but that we do need a social protection system. Also, another innovation was that conditionalities were relaxed. And it was very important. From the Minister of Social Development of Guatemala, we heard a call to move towards universal social protection system. So the message from the region, where we had a lot of targeted and conditional programs, is in times of crisis to look and move beyond the short terms toward these universal social protection systems. Obviously, there are challenges in terms of financing, but it's time for social compacts and fiscal compacts to move towards universal social protection. Thank you.
Thank you very much, Simona. So this concludes our retrospective for day one. So if you feel like, wow, I missed something and you couldn't participate, all these sessions are of course available on our video links. So if you are going to the socialprotection.org conference website or to the Social Protection YouTube channel, you should be able to see the videos of each session. So let's move on to day two. Day two was our thematic day. As I mentioned, we had the clinics and we had the round tables. We had also the virtual booth. And also on that day, many people did an activity called a virtual contribution on our self-reflection board. So I will hand over actually to Valentina Barker and Martina Bergthaler. Valentina is currently the team leader for the UK and Germany funded social protection approaches to COVID-19 team. Many of you know it as SPACE. And she will be supported by a consultant and social protection expert from Germany who used to work for GIZ in Indonesia before. So they will give key insights and takeaways from the thematic discussions and on the virtual contributions from participants. Valentina, Martina, the floor is yours.
Okay, thanks, Joost. I hope that you can all hear me. So good morning, good afternoon, and good evening, everybody from Austria, not from Germany. So thanks for joining the global session of this e-conference, and it's really a pleasure for me to have this opportunity to give you short key insights of the discussions and main takeaways from the different forums that we had on day 2 and day 3 of this conference. As you said, I'm going to do this together with Valentina Barker. And if we move on the next slide, we have a quick overview what we are going to do. So we will start by highlighting the most important key takeaways from the roundtables and the side events. And then Valentina is going to continue after that to give you some insights to what has been discussed in the clinics on day 2, and also summarizing the results of all collaborative activities that were going on during the last 3 days. So yeah, I want to start with the roundtables, and I'm sure that you had a look at the program. We had 14 roundtables, and I also want to take the chance again here to thank all the hosts and organizers of these roundtables for all your efforts that you put into that. I had the chance to listen to a few of them, not to all of them, and I really enjoyed the fruitful and lively discussions that were going on and that have shown a lot of how to respond to this crisis and how also to build back better in future. So what I'm going to do now is just shortly giving or highlighting some key insights and takeaways from these roundtables. What I definitely can't do within these next 10 minutes is to give you the full justice of the rich and diverse discussion in all these roundtables. So therefore, in case you did not have the chance to listen to them or to watch them, you can also visit the conference website and watch the videos, and the links will be provided there. So what I'm doing is I clustered the 14 roundtables into 3 groups. The ones focusing on focus on population, on specific population at risks. Then another group that was focusing on specific social protection measures as a response to the crisis. And then another cluster focusing on cross-cutting issues such as governance, financing, improved cooperation and coordination. And I'm going to start with the first group that I mentioned. So we can move to the slide with the specific population at risk. Can move back there. So in there we had in total 5 roundtables. And the discussion was much around highlighting the problem that some social protection measures taken during this crisis have been non-inclusive. They often have been gender blind or also not age and disability sensitive, or sometimes even altogether. In socioeconomic responses to the COVID crisis extended to citizens has most often also excluded migrants. As one concrete example in this specific roundtable, it was mentioned that up to 70,000 international migrants were stranded in Southern Africa without any access to any services or social assistance during that time. And the discussants of these roundtables therefore stated that this crisis should be taken as an opportunity for building back better, gender responsive, age and disability sensitive, as well as inclusive social protection systems. Then we can move to the next slide, which is going to show the roundtables with a specific focus on specific social protection measures. And there we had, one slide back, please. Yeah, this one, perfect. So there we had one roundtable focusing on social health protection that highlighted the key elements that supported effective response by existing health protection systems. And in particular, it highlighted the importance of strong institutions and entitlements based on a rights-based approach embedded in a legal framework. And this was, of course, a key takeaway, not only from this roundtable, but also from other discussions and sessions we had during this conference. Then we also had a roundtable on unemployment protection and its extension to workers in the informal economy. This session, as many other sessions, highlighted the problem that this crisis has particularly affected the able-bodied adults that were often left out of social protection or traditional social protection systems, and in specifically the informal economy, the so-called missing middle. And therefore, moving forward, countries would need to transition from emergency measures to more sustainable mechanisms, establishing strengthening rights-based social protection schemes also for informal workers. In this cluster, we also had a roundtable on food security and nutrition roadblocks in social protection responses to COVID-19. And this roundtable highlighted the need for improved multi-sector collaboration and cooperation, as also a lot of other roundtables did. The same is true for the need of comprehensive and up-to-date data, a topic also brought up in many roundtables, and we even had a dedicated session on microsimulations and the use of data on that as a roundtable on that one. So what is needed is data on how the pandemic is really affecting households beyond the fact that we know that incomes and food consumption have been affected, and also data on how urban populations have been specifically affected by the pandemic, data to support coverage of social protection programs and the adequacy of the packages. And only to mention a few, these issues have been discussed over and over again in different sessions of our conference. So then we also had a roundtable on transitioning out of emergency transfers and what's next for UBI. I think a very timely and lively discussion that we had there. And it was concluded that basic income at the moment is a response to the pandemic and has brought much about digital innovations in identification and delivery mechanisms. And UBI really needs to leverage digital technologies for wider reach. And this is also true for other forms of social protection as well. But it was also highlighted during the session that a universal basic income is not only a technical issue, but it also requires a lot of political buy-in from the population and political will. And it needs to build on a strong social contract. So that's the key insights from this discussion. Then maybe one point that I still can mention there is also that the UBI is feasible in financial terms in many countries. It would cost, or it is estimated that this would cost some countries spending 1% of GDP and for some others up to 9% of GDP. And at the moment, countries may consider reshifting expenditures or going into debt instead of taking up new taxes or contributions. And actually, this brings me to the next set of roundtables. So we can move to the next slide, which are the cross-cutting issues. And of course, one very important cross-cutting issues that was dedicated also in a separate roundtable was the issue on financing. Again, this was a topic discussed in many different fora, and this one only put a specific spotlight on that. And I think the financing issue will become even more important in the medium to long term when austerity measures are about to start. So let's not forget about that. And therefore, it was important that this discussion also highlighted that it is definitely necessary to invest more in social protection through domestic resources mobilization, including through more taxes and contributions. So a little bit contradictory to the other one. And this could also provide a pathway for further formalization of informal economy, again, a topic that we have heard in many of our discussions that we had over the last days. But it is also evenly important to invest better. So not only to invest more, but also to invest better in future social protection systems. Then there was a roundtable on different perspectives of the role of political economy. Also a discussion that we had in many of the roundtables, and this one re-emphasized that an increased recognition by policymakers that there is a critical need to invest in social sectors is taken now, and that education, livelihoods, jobs, nutrition, health systems, and of course social protection should be at the center stage of the crisis response and beyond. Maybe last but not least, I can also still highlight the discussion that has been going on in the roundtable on opportunities for strengthening links between humanitarian cash transfers and social protection, and what can be learned from the COVID-19 crisis. This was a very concrete example of intersectoral cooperation and coordination in the wake of this crisis. And it also highlighted that there is a need for a common vision and common principles of operation program design. And these are crucial and critical if humanitarian social protection systems want to work together in future. And I think with this common vision and common principles to build back better, or even to build forward better, as it has also been stated in some of our fora, this will be needed in many respects in future. We can move to the next slide, and this is the last one. So this only gives a short overview of all the side events that we had on day 3 of the conference, and many of these side events dig deeper into the issues that I also highlighted and the key takeaways. So also please take the chance and watch the recordings of the side events if you have time after this closing session. And with this, I want to hand over to Valentina, and she's going to do the wrap up of the clinics. Thanks.
Fantastic. Thank you so much, Martina. So over to the next slide. Hello, everybody. And to start with, actually, I wanted to start with the collaborative activities. And these were very much developed in the Transform spirit. And Transform, for those of you who don't know it, is the curriculum on building social protection floors. And what is that spirit? I mean, we've had a lot of fascinating talks and events and roundtables at this conference, but ultimately what matters is, what does this mean for us, for me, for my country? And so this is a bit of an opportunity for the so what. And these activities were developed around this kind of framing for the conference, and you'll have seen this slide before if you followed, for example, day 1. And the idea is that overall, all of us kind of across sectors, not just within the social protection sector, but also others mandated to respond to shocks, we're aiming for common outcomes, and we're trying to better meet people's needs by extending coverage, comprehensiveness, and adequacy of our systems, and especially in a crisis, because those needs are increasing. And we're trying to do that in a way that's timely and sort of responding when people need it, cost effective accountable to affected populations and sustainable, so that our short-term actions have longer-term consequences. That kind of think short-term, act short-term, think long-term. And all of this depends kind of on our existing systems that we have in country. What we can do is based on what we can leverage within our countries. So with that spirit in mind, if we go to the next slide, the first activity was the self-reflection activity, just zoning into 4 of those dimensions that I've just talked about, and an opportunity for us to be thinking about those in terms of our country and just reflect what happened, how did we respond, what have we learned from it, what would we do differently next time if we had prepared. And we've had a lot of interesting participation on this activity already. There's still time for you to be engaging as well, so please do. If you go to the next slide, I just wanted to just give one example, for example, on the dimension of coverage, where we had the Uganda Parliamentary Forum on Social Protection reflecting on the need to extend beyond the formal sector. And in fact, even if you scroll down, for those of you who started to engage with this concept of coverage, a lot of the themes emerging were those that were already presented by many of you before me, the concept of this whole missing middle and sort of informal workers left out from routine systems for social protection, and what this has implied with the COVID-19 response, but also discussions of universality of urban populations often being missed out by routine programs as well. So do engage with this one. If we go to the next slide, the other kind of self-reflection activity, no, actually, before I talk about that, I just wanted to say that part of this kind of reflecting is also an opportunity for us to just be realistic and be honest about what worked, what didn't work, even those ideas that might have developed and then weren't feasible, weren't practical, but they might be possible in the future if we build towards them. And this is the concept of failing forwards that was discussed in a side event yesterday, and also of the broader preparedness, what we can be doing today so that next time we're not kind of caught unprepared again. And there's a lot that can be done on this, and we'll be sharing some resources on that as well. Okay, so going to the next kind of self-reflection activity, the commitment wall. This is, again, we've had a lot of big objectives being discussed and sort of the very grand, even these outcomes we've been discussing. But what do these mean for me, kind of for us in our individual capacity? What is it that we can do as individuals working within government, within any organization we're working in? We all have different roles, but we can all be pushing towards these common goals. And so these are, we've materialized these with this commitment wall, where you're able to kind of make your own commitment, your practical actions that you could be doing to push towards these common outcomes going forward in the next few years. And if we go to the next slide, there's also the opportunity to be doing this by video. And in fact, if you send us your videos during the break that we'll be having soon, we'll be able to actually share this final video commitments with you quite soon. Okay, so next slide, I'm going to start talking about the clinics. And the clinics, again, these were an opportunity to go beyond the wall, the glass wall between the presenters and people in the audience, and for the audience to be proactively asking some of those nitty-gritty, even quite simple questions, but of how did another country solve this problem? What is it that I could be doing differently to kind of, how could I learn from somebody else on some of these core topics that have been mentioned already by other speakers? And all of these with, again, the focus on these outcomes we're collectively trying to achieve. So if we just very quickly go kind of and take a look at these, next slide. The process we went through was questions being submitted on Slido, then being prioritized using the like function on Slido, so that the most priority questions were moved up to the top, and then we started discussing the key questions that were up at the top within live sessions, and there were 2 of these within 2 different time zones, and each of these has an outcome document, a discussion forum document associated with them that is still live, and we'll be sharing links to each of these now with you, and you're absolutely welcome to contribute and kind of add your experiences from wherever you are standing within your country. So over to the next slide. The first clinic 1 was on financing for future crises, and here kind of one of the core questions that was debated was how do we ensure funding to expand when we're struggling to finance kind of routine social protection. And there was a lot of discussion on what is the cost of not responding, and the fact that with increasing shocks, where basically shocks are becoming key drivers of poverty and vulnerability, and we will have to be incorporating that understanding into financing routine systems as well as expansions. And quite a lot of discussion on different instruments that could be used, how these could be appropriate to different countries, including disaster risk financing instruments. And I'd invite you to take a look at the discussion forum, which is ongoing on that. Next slide, please. Clinic 2, oops, sorry, one back on gender and disability sensitive social protection. I mean, here again, the core issue was that we can't be thinking of these as standalone from poverty and vulnerability. They're very much working together, and if we don't recognize this, we won't be able to reach any of our joint objectives. And when we're thinking through our programming, if we're being neutral, we are de facto being discriminatory if we're not considering the specific needs of the different populations that we're trying to serve with our systems. So just as one example, when we're thinking about adequacy, when you're thinking about people with disabilities, the costs that they're facing are much higher than other population groups. So we'll have to be taking that into account. So both in design and implementation, those need to be considerations that we're continuously making. And there was incredible discussions on this and a lot of other topics that I can't do justice to. If we go to Clinic 3, and I'm going to talk about this together with Clinic 6. So here we were focusing on both digital. We have this in brackets because they weren't necessarily digital. Some countries and in the regional roundups, you've discussed a lot of those examples that have been circulating of countries that have done have used very innovative methods to reach new caseloads. But some countries didn't, and so we in that clinic we did a bit of unpicking of what these different options were, which ones were feasible where and why, and kind of digging into some of the examples and sort of the nitty gritty. How did they actually do this? Was there an ID system as a backbone? And again, if you take a look at the discussion forum that's being shared, you'll be able to find some of the answers to the core questions that were coming out on these two topics. Next one, so Clinic 4 was about preparing for future shocks and working together with the humanitarian sector. Again, acknowledging that we're trying to achieve the same outcomes, and we need to be doing this together. There was a lot of discussion on coordination and how that could be improved, and some kind of really interesting discussion on what actions could already be kind of set in place and working together for preparedness for future shocks. What can we be learning from humanitarian actors so that we set up our systems, both in terms of our routine systems, but also in terms of being able to respond to future shocks? How do we do that system strengthening together? So again, do have a look at the discussion forum on that. The Clinic 5 on linking social protection, employment and economic inclusion, very much recognizing that this was a challenge already before the crisis. Getting people into secure livelihoods was already a challenge, but and it is even more a challenge now, but it is also more of a high priority topic. And there has been a lot of learning in recent years from economic inclusion programming and linking social protection to livelihoods and employment that can be leveraged in the aftermath of this crisis and should be leveraged, and really important discussions there. Clinic 7, let's jump upwards because 6 we've already covered. Another crucial topic coming up again and again in all of the roundtables as well was the issue of informal workers and more generally the linking and transitioning between non-contributory and contributory social protection, and the fact that we can't view these as two separate beasts, and kind of fragmentation is doing nothing for us right now, and also discussing some experiences of countries that have succeeded, what works, what doesn't, the fact that voluntary coverage doesn't really lead to effective extension of coverage. What does work is more subsidized mandatory coverage, providing the right types of benefits and services to people so they actually have an incentive to be joining, not just kind of longer term benefits they might see in a distant future, but more tangible and concrete and things that might have consequences right now. So again, the depth is in the discussion forums. You can also watch the recordings of the clinics, and ultimately the messages for here were that, as Shahrazad said in the introductory panel, we are at a crossroad. This is an opportunity to take the right road, to prepare for the future, to fail forward. Let's do this together and learn from each other. And I think the clinics, intrinsically, they had so many different partners coming from different points of view and leveraging kind of some of the coordination mechanisms we have in this sector. So I was very happy with them. Thank you, everybody who joined.
Thank you very much, Valentina, very much, Martina. And I just wanted to mention that Valentina and Martina both were part of the core team which organized this conference right from the beginning. So thanks a lot. We are now coming to the part where we want to talk about the future, the way forward for social protection in times of COVID-19 and beyond. But before I introduce you to the moderator of our first expert panel, I just wanted to tell you that we are actually going to use Slido. Slido, this is a tool we used also in the round tables and in the clinics. If you will look at your chat box, it will pop up. There you can go to a specific tool for asking questions and also the possibility to upvote the questions so we know which are the most popular ones. So look at the chat box. My colleagues are posting the links, and I am sure most of you know how to do it. So we are not going to use the Q&A you see on the Zoom. We are actually using a special tool called Slido. It's actually much easier and also nicer to see the graphics there.